So welcome back to my channel, Simply Jaleesa. I am a registered nurse. I work in cardiac ICU, and I'm an ADN and BSN prepared nurse. And so I wanted to come on here and talk to you all about how to pass nursing school. So you all have heard that nursing school is different than anything that you've ever taken before. I have a bachelor's degree in another field, and nursing school was totally different. The tests are scenarios. They are not clear cut. They require you to critically think. And critically think is a word that is going to be new to you if you are not familiar with it. That is something that nursing school is all about, critically thinking, which means you have to use all of your knowledge, all of your resources in order to make the most appropriate decision for your patient. And that means you have to make sure that whatever you choose, whatever intervention that you choose, is the one that is going to help your patient the most. In order to critically think, you have to make sure that you go over all of your material your nurse instructor provides, whether it's PowerPoints, whether it's chapters in your book, whether it's chapters in your ATI, taking your online practice test that you need to do in order to make sure that you know all of the correct answers for that particular scenario. That may mean if you have a patient that has diabetes, you need to know everything about diabetes. If your patient has hypertension, you need to know everything about hypertension. You need to know the disease process, the pathophysiology. You need to know the meds. You need to know how the meds react to each other. You need to know interventions for hypertension. What do you need to do as a nurse? That requires a lot of study time, a lot of studying. So I suggest that you make sure that somewhere in your schedule, whatever you're doing, that you study for these tests. So your instructor may put a question on the test that when you went through your PowerPoints to try to remember, you're like, that wasn't on my PowerPoints, but she got the information from your text. And you may miss that question because you didn't read the text, you just went over the PowerPoints. So I highly suggest that you do both. I know that it's a lot of reading, but that caught me up every single time until I figured out what I needed to do. I needed to open up that book and I needed to read those chapters and dedicate time to ensure that I knew all of the information that I needed. So what is usually a select all that apply question? Well, you're always going to look number one for safety. Safety issues are the most. Safety is, did you scan the armband? Did you go over the 6 rights of medicine? Was it the right dose? Was it the right route? Did a physician sign off on it? Is it the right patient? You're going to be looking for a lot of those things. Did you don gloves? Did you wash your hands first? Did you introduce yourself to the patient? Things that are safety related, that is a flag for you to probably check it in your select all that apply, because you want to make sure that safety is first. NCLEX is testing you on safety, and those are some of the questions that I ran into on my NCLEX as well as my nursing school exams, was making sure that patient safety comes first. And if you look at select all that apply and you're like, I really don't know. Look at each question as a true or false. Is this true? Is this false? Don't group all of those answer choices together to make them make sense. You look at each question individually. Is it true? Is it false? If it's true, you can kind of put a little dot by it and it's like, okay, maybe. If that's false, you can X that one already. One way to know if a question is false is if it's always or never. Always and never questions are always wrong. They are never right, because there are some things that you can do as a nurse before you pick an always or a never. So keep that in mind. Always and nevers are never the correct choice. After you have taken your test, if your instructor allows you to review your test, say that he or she has graded your exams, and they want you to sign up to when you can come into the office and look over your test, I suggest that you do that because those questions will pop up on your comprehensive exams. And so they may throw those same questions on a test, but you did not take the time to go back and review the test because you're just like, maybe I made a 90 on the test. I missed a couple of questions. I'm fine. I made an A. Well, those couple of questions may end back up on a test 2 exams later. So review all of your previous tests because your comprehensive exams at the end of that particular semester may have some of those questions that your instructor put on the previous test. So don't miss out on some freebie questions when they have given you the answer. So that wraps it up for me. Just remember to breathe, remember to relax, remember that this is another field that you're going into that you're just not that familiar with, but you will be. You will be able to master a lot of the things that you may not be able to master that first semester. So thank you for making it all the way to the end of my video. I hope you are able to use some of the tips that I went over in order to feel better about taking your exams in nursing school, and that you can ace your exams as well, because at the end of the day, that is the end goal. So please like and subscribe to my page for more nursing tips and tricks in order to succeed in nursing school. Because remember, nursing may be hard for you, but it is not impossible, I promise. Because yeah, you really can. See you next time.